Right, let's check in now live with the president of Hartford HealthCare Medical Group, Dr. Mark Prete. Dr. Prete, thank you very much for joining us live from Hartford HealthCare Studios this afternoon.
Thank you.
So Hartford HealthCare built a virtual health platform to identify patients who qualify for COVID-19 testing. How is that going so far?
It's actually going great. We started the platform on the 17th of March. And we aligned with our, as you know, we have a COVID hotline. And so we took the COVID hotline and started adding virtual visits on to answer questions about testing. And so to date, we've gotten 1,500 telehealth, we call them virtual visits, done. And that allows us to really screen patients who need testing. And since that time, we've also created two other channels. One for all of our primary care doctors, which is about 200. Our specialists are being rolled out this week as well. And we also have a partnership with GoHealth doing telehealth as well.
And are people responding to it? That sounds like a very good number that have adapted to this pretty much new way of healthcare. Well,
it's actually accelerating. Besides the 1,500 we've done through the COVID hotline, since we've rolled it out to our primary care doctors and our specialists, we've already scheduled 1,000 a day, and I think we're going to get up to about 2,000 a day, because it really does change. It allows an encounter with your doctor that is integrated with your medical record. It also allows for a video conference. And so it really is a good way to do this in this setting. But I'll tell you, I think after we're through this crisis, I think virtual health is here forever because it really does provide a benefit to patients.
It's really been amazing seeing people adapt to it. Okay, that's great to hear about the general health doctors. What about specialties? Are they doing virtual visits too?
They are. In fact, it started this week, and most of our specialists, we have 500 or 600 of them, will be up on the platform by the end of the week. So we've already had great success with, our cardiologists, our cardiovascular surgeons, vascular surgeons, general surgeons, using it not just for COVID, because that tends to be primary care-based, but they're using it for post-op visits, for follow-ups, and now for consults. So it's really kind of amazing how it's been, it's taken on.
It really is. That's great to hear. Okay, what about urgent care? Can that be done now through virtual visits?
Yes. Now, the basis of virtual health is we don't want to replace an emergency visit or something that's serious. But telehealth can accommodate a lot of urgent complaints. In fact, our partnership with GoHealth, they're poised to do this as well. There are many things that can be handled through a virtual encounter with your provider.
That's great to hear. All right, so tell us now, how can a person get a COVID-19 test through Hartford HealthCare?
Right now, it's through the COVID hotline. It's the 860-972-8100. That provides you access to nurses who screen, and then if indicated, a virtual health visit is scheduled, and then we screen patients for the need for testing. The primary care doctor is another source of access, and they will determine whether that visit can happen in person or virtual.
All right, Dr. Prete, thank you so much for taking the time. Sounds like great progress being made for healthcare, all kinds of healthcare. So thank you very much for bringing us up to date. We appreciate it.
Thank you.
Thanks.
My pleasure.